What is DiGA in a nutshell, and what does it offer to startups?
Well, it was a world's first insofar as digital applications became part of regulated healthcare in Germany. Through the DiGA fast track legislation, startups have the opportunity to quickly develop apps and bring them into the normal statutory insurance market, which means that physicians can prescribe them and they will be reimbursed. Startups will be reimbursed based on usage of the apps. So basically what it meant for patients and physicians alike is that beyond the prescription of medication and other supportive gear, they now also have the opportunity, the possibility to use digital applications to support their patients.
Mm-hmm. And how do you evaluate the implementation of DiGA since the Digital Healthcare Act came into force in December 2019? What has been achieved so far?
Well, to be honest, it's been a privilege to actually be part of this process. And so far, it's very rare that you actually have legislation happening and you actually can see the effects in real life within one legislative period. So indeed, it was passed in December 2019, and then we already had the first listing of a DiGA in fall of 2020. By now, it is 20 DiGAs, 20 health apps that are being listed by BfArM that can be prescribed. And we had the first prescription, incidentally, I think it was October 7th. Of last year. Since then, many thousand prescriptions have happened. Clearly, this is a process that takes time to educate physicians and patients alike. So we're clearly not where we will be in a number of years, but it has been a really terrific start.
Mm-hmm. And what are the challenges for the future?
Well, I'd say, really the educative process is really a major aspect. And it's not just patients, as I said, it's also healthcare providers, physicians. We're going to see also digital apps in the nursing arena. So there it is, the same thing will happen for physiotherapists, etc. And beyond that, it's a matter of pricing. It's something that is new in our system. So the pricing will need to be adapted, and more than many other products, of course, there are scale effects in digital products. So I suspect that we will have some dynamic pricing aspects, which will depend on the number of usages. And then, finally, I'd say, this needs to become a more even integral part of our healthcare system. Right now, it is being financed really outside the classic system. But it is fully financed. It will be more integrated into the system as we go on.
Mm-hmm. And if a startup is interested in DiGA, what should be considered as a first step?
Well, there is a very well-defined application process, and the good news from a DiGA's point of view. The application process, obviously has to be filled and has to be followed. But once it is, the BfArM only takes 3 months to render a decision. So after 3 months, you know whether you're going to be listed or not. And the BfArM has been very good in interacting with the startups so that they really know where they stand. And once you are listed, there's two possibilities. Either you're listed forever, in which case you would have had to provide the evidence that your DiGA truly provides better healthcare. And if that's not yet the case, you can be temporarily listed and use that time, 1 to 2 years, to generate the evidence that is needed to support your claims.
Thank you very much, Professor Debatin.
You're very welcome.